Hello and welcome to Health Digest, your go-to program for timely, relevant, and people-focused health conversations. I am Ukeme Etuknwa. Today's edition is highly significant as we spotlight maternal mental health in line with global conversations around the world. Maternal Health Day marked every May 6th. Motherhood, as you know, is often celebrated as a joyful journey, but for many women, it also comes with emotional, psychological, and physical challenges that are not often talked about, from postpartum depression and anxiety and the pressure of caregiving. Talk about it, I have a toddler. Now, maternal mental health remains a critical but under-discussed issue. On today's program, we'll be exploring this theme from different angles, bringing together stories, insight, and innovations shaping health outcome, both locally and globally. Now, let's get started. We begin with our health news segment, where we bring you a roundup of key developments shaping the health sector, both at home and around the world.
The Federal Capital Territory Authority described the initiative as a major step in the fight against HIV. According to FASAWI, the introduction of LENPRE marked a shift in the prevention strategies, particularly for individuals who struggle with daily medication adherence.
In about 2 years' time, we will start to see how this has impacted on our figures and the population of people living with HIV. What we want is zero new infections and continue to support those who are already infected.
She, however, noted that the new injection does not replace existing prevention methods.
And the general public too is hereby being sensitized that these medications are for free. Anyone who sells it to you is committing fraud. Primary, secondary, tertiary partners, it is for free.
It is not given as a vaccine for you to develop maybe some immunity against it. No, it is given as a prevention drug, and it's not given in isolation alone.
Available records indicate that the FCT currently has an HIV prevalence rate of about 1.4%, with more than 60,000 people on treatment, with prevention still remaining critical to sustaining progress. Dimas Nanzung, AIT News, Abuja.
Conversations around mental wellness are slowly gaining ground here in Nigeria. But for millions, the struggle is still shrouded in silence, fueled by deep-seated stigma and a lack of accessible resources. For the vast majority, professional care remains out of reach for years, even decades. This was the story of Hawa Ojefu. Hawa's situation was quite complex. She was a victim of sexual violence who later was diagnosed with bipolar and post-traumatic stress disorder, PTSD.
I was raped in my own bed, and I had to see my rapist almost every single day for a year. And due to victim blaming and shame in the society, I couldn't speak up and get the support that I knew that I needed to get. And so I recall having extreme mood swings over a period of time. And on the one hand, I would be so down and so sad and physically unable to get out of bed in the morning. And on the opposing end, I would have these bouts and bursts of energy with happiness and ecstasy, and I would be so glad. I would start all these activities and to feel like, oh, everything is fine. I'm back to being this person that I'm supposed to be. But I realized then, that I was living with bipolar.
Her condition got worse when she almost had a near-fatal mental health crisis in 2016.
2015, years after I was raped, my bipolar highs got higher and the lows got even lower. And what was once bearable and manageable, became so unbearable.
She says the turning point for her was when she realized that staying silent would be a life or death situation. And so 2 months after her diagnosis, she began her battle by transforming her personal struggle into a mission to support others and advocate for mental health awareness.
It took nearly 4 years for me to tell my family and friends that I had been raped. And Even though the shame wasn't mine to bear, I increasingly felt the heaviness of it. The burden of an untold story is far more dangerous, in my opinion, than the story itself. That was actually the thought that drove me to start in She Writes Woman.
10 years after, the She Writes Woman was founded. Hawa is looking at the milestones and pushing for a renewed call for urgent government help for sufferers.
It's really built around this revolutionary idea that people need people to talk to. Simple. You can call a helpline and you might not say much, but someone will listen and someone will care. And so this has been the core of what support has looked like for us. It's driven by people who understand lived experience, and it is given to people wherever they may be, physically, geographically, but also within their mental health journey as well.
The anniversary wasn't just about policy. It was about people. Attendees shared deep personal stories, marking a clear shift from silence to advocacy. One participant noticed that women are disproportionately affected, not by chance, but as a direct result of societal pressure and systemic neglect. For her, the event provided the first safe space in years to speak openly about her journey.
How did society put us? Because every day we wake up to a society that wasn't built for us, a society that didn't choose us, a society that didn't see us, a society that does not want to work with us. They see us as nothing but just the disability we have. And this has affected us greatly. And meeting with She Writes Woman was different for me because it was the very first safe space I experienced. I will never forget that day when I was with Hawa Ojiko and the other young advocates. And we were sharing our experiences. And that was the very first day in my life I was able to voice out something I've held for years.
The highlight of the gathering was the unveiling of a 10-year impact report. The document maps the current reality of mental health in Nigeria and outlines the blueprint for a more inclusive, responsive care system. As more Nigerians find the courage to speak up, advocates insist that breaking the silence is only half the battle. It must be matched by real investment in healthcare infrastructure. Until then, millions will continue to fight this silent war alone.
I hope you enjoyed that. You're still watching Health Digest, and I am Ukeme Etuknwa.
You are welcome, all the champions in the house.
In a bid to create cancer awareness in children, the Ukeme Children's Foundation gave up its time to promote activities children diagnosed with cancer.
An opportunity for us to sensitize the public about pediatric cancer. So we're going around the city, making as much noise as possible in the process, educating the public about childhood cancer. We're also sharing, flyers that contains information about, pediatric cancer. And we've encountered a lot of persons on the way who had no idea that children actually have cancer.
It all started that I purged, I vomited sometimes. I was dewormed, but there was no remedy. Not until when we went to UATH and they tested me, but the test was pretty long, so we run scan and they said it was cancer.
It organized a public rally aimed at spreading awareness about childhood cancer, which brought about volunteers from the medical professionals, families, and supporters who matched with a mission to spread love, hope, and healing.
When you start seeing all those symptoms, take your child, go check what actually is wrong with them.
For me, I would say don't leave anything to chance or to guesswork. If you are feeling ill, they should go to the hospital.
The Ukeme Children's Foundation, in partnership with other non-governmental organizations, works hard to change the narrative for childhood cancer in Nigeria and in the health field. Ukeme Etuknwa, AIT News, Abuja.
Welcome right back. You're still watching Health Digest. Now, access remains one of the biggest challenges in healthcare delivery across many parts of Africa. But innovation is beginning to change that narrative. In our healthcare segment, we're going to be exploring how mobile hospitals are bringing healthcare closer to communities in Kenya, offering a new model for accessible and affordable healthcare. Stay tuned. Let's take a look on health tech.
Bridging the gap between patients and healthcare, a Nigerian-led innovation is transforming access to medical services in Kenya. At the center of this is Ikechukwu author Anoke, founder and CEO of Zuri Health, a digital health platform that delivers care directly to undeserved communities. In Nairobi, the company has deployed a fleet of mobile hospitals fully equipped, clinic buses bringing essential healthcare service workers to where people live and work. Unlike traditional outreach programs, these units function as self-contained clinics, offering general consultations, diagnostics, dental care, and even cervical cancer screening. Powered by solar energy and supported by digital platforms, the model combines physical care with telemedicine, ensuring patients can access follow-up services beyond the initial visit. The initiative addresses a major challenge across Africa: limited access to healthcare, especially for low-income and informal workers who often face long travel times. By taking healthcare directly into the communities, these mobile hospitals reduce barriers, making care more accessible without disrupting daily livelihoods. As Africa continues to confront healthcare inequality, innovations like these are redefining what accessible healthcare looks like in the digital age.
Welcome right back. It is time for Weird Health Stories. I know that sounds really crazy. Now, we're going to be on to something a little different. Across the world, cultures have developed unique approaches to health and hygiene, some which may seem unusual at first glance, but were deeply rooted in practical traditional conscience. I'm not talking about the COVID wash your hands. Nope, nope, nope. In today's Weird Health Story, we're exploring the fascinating cleansing rituals of the Himba people. I'm talking about the surprising health benefits behind their use of clay, butterfat, hear me out, and herbal smoke. Stay with us.
In part of southern Africa, the Himba people have developed a unique way of staying clean without using water. Now, instead of bathing, they use a mixture called otize made from butterfat and red ochre, a mineral-rich clay which they apply to their skin and hair daily. While it may seem unusual, this practice serves several important health purposes. The red orchid contains iron oxide, which acts as a natural shield against the sun, helping to reflect harmful UV rays and reduce skin damage in harsh desert conditions. At the same time, the butterfat helps lock in moisture, preventing dryness and keeping the skin soft and protected in an environment where water is scarce. The mixture also forms a protective layer over the skin, helping to keep out dirt, bacteria, and even insect bites. And instead of traditional bathing, the Himba use herbal smoke baths, allowing antimicrobial smoke to cleanse the body while leaving a pleasant scent. What may appear unconventional in reality is a highly adapted system of hygiene designed to protect, nourish, and maintain the skin in one of the world's toughest climates. That's it on Weird Health Stories.
Welcome right back. I hope you enjoyed that. Now, as we focus on maternal health today, it's important to hear directly from those living the experience. In our chat with the expert segment, we're joined by Ukeme Etuknwa, who shares her journey as a new mother. I know it's an moment, from the emotional realities of early motherhood to the milestone lessons and the critical role of early nurturing in a child's development. Here's that stimulating conversation. And And today with me, as I did tell you, we have a professional in the house. He likes to go by the name Professor Theddeus, and he's going to be giving us the insights when it comes to maternal mental health, which is, commemorated on the 6th of May, but I think it should be a lifelong duty. Trust me, I have a toddler, so I know why. Without further ado, here is our psychosocial therapist, and he wears so many other hats, and I'll let him tell him himself. Thank you so much, Professor.
Oh, thank you. It's a pleasure to be here, and thank you for highlighting this major mental health issue, particularly in Nigeria. I'm really delighted to be here. I am a psychiatrist by profession. I did medical school in Nigeria. I've done my psychiatric training in Europe and the United States, and right now I work between Nigeria and the United States. So I shuttle between the two countries, and I'm delighted to be here.
Absolutely beautiful. When we have you in the country, you're definitely going to be with us live because, like I said, it shouldn't be restricted to just the 6th of May. So let's get straight to it. In your opinion, why do you think this day is important? What is maternal mental health? A lot of people say, are you the first one to be a mother? Is it your first time? Are you the only one? Now only you waka come. Please help me break it down in a language that my people will understand.
Oh, absolutely. So first of all, why do we have a particular day set aside for maternal mental health? Is mostly to create awareness and to create understanding of the specific elements of mental health for mothers, mental health for women. And why is it important to focus on women's mental health and maternal mental health? Because, as you know, particularly in our culture, the woman is the fabric holds the fabric of the house together, hold the fabric of the community together. And so if you have a woman, a mother who is not doing well mentally, it's going to impact her child, it's going to impact the husband, it's going to impact the family, it is going to impact the community. So it is really important to highlight, create awareness about maternal mental health, especially in a society in Nigeria.
Thank you so much for those insights. Now, when a woman, goes through the stages of pregnancy, are there some changes that happen psychologically in the woman? Are there some hormones? Sometimes you see a person who has a particular character during that process of pregnancy. Even I myself, we'll speak on that another day, but yeah, a lot of different women change, some for the better, some have cravings. I mean, for me, I had certain smells that I couldn't, stand, and a lot of other women out there, they have cravings of different things. Is there something that actually happens psychologically when it comes to, the whole maternal phase and pregnancy and conception?
Absolutely, and I'm glad that you mentioned it. So all of us go through biological changes over our life course. For women particularly, pregnancy is a major change in the body, as you can imagine, and as you yourself have experienced. So the body changes physically, but it also does change psychologically. So low tolerance for irritability, maybe craving for some things, maybe needs more attention, maybe feels a little bit happier, maybe feels a little bit sadder. So there are psychological changes that are within normal for a woman going through pregnancy, from being pregnant to having the baby to after having the baby. So there are definitely physical and psychological changes. Now the question is, when does those psychological changes become abnormal changes? When do they become a challenge? When do they become a problem? And so that's something when we try to differentiate between baby blues, which most women go through, and then postpartum depression, for example, which is where there is significant prolonged sadness and dark thoughts, particularly about the baby. And this can really be dangerous for the mother and the baby. And that is where we really need to make sure that we screen women who are pregnant and who are having babies for depression and anxiety across the course of the pregnancy and also postpartum, to identify it early and provide them support as needed.
Thank you so much for that. Thank you for those insights. You mentioned baby blues, postpartum depression, and these are, in this day and age, it's not a new term, but it's one that we are now getting to understand more. We're now getting a label for certain attitudes, characters that, you know, before our village people, sorry to them, used to get blamed for. But now, when you look at it, these are some of the underlying reasons. I had a very good friend who had the most gorgeous baby. She's a beautiful woman, but she hated, almost like she hated this kid. I used to nurse the kid, feed the kid, and you know, people would say different things. At the time, we didn't quite understand, but there was this detachment that she felt. Could you give us a bit more insights into the psychological and mental aspect of this, and what exactly is postpartum? What is the postpartum phase, and what comes with it mentally?
So thank you. That is really a good example that you gave, which is what we really don't want to happen too much or too often, and what we want to address and prevent. So postpartum depression is really just depression that happens around pregnancy. More now, we'll call it peripartum depression because it can happen before the baby is born, but commonly happens after the baby is born. So it's called perinatal depression. So it happens around the time of the baby. And it can get worse. People can become almost like psychotic, you know, having very negative, very bizarre thoughts about the baby, which is the extreme form of it. So it can happen, and it can happen, like I said, anytime across the pregnancy or after the pregnancy. Usually, if a woman is having, you know, the usual baby blues, meaning, you know, feeling some mood swings, some sadness, some mood changes, usually it doesn't last too long. After a couple of days, maximum maybe a week or two, and it goes away. If that feeling of depression or sadness persists after more than 2 weeks and becomes darker and more negative, particularly towards the baby after 2 weeks, you're looking at postpartum depression, and it needs to be treated. That the key here is that it's not something that will go away by itself. Usually, it gets worse. So the key element to understand is if these sort of baby blues, minor mood swings, become severe and last more than 2 weeks, the woman needs to see someone for support, therapy, maybe medication, and you know, all of the support they need to recover from that.
Welcome right back to Health Digest. I did tell you that we're going to be speaking with a very, very interesting person. I mean, there's someone in this world who looks at her like she is the most important person in the world, aside from God. I'm talking about her baby. She is a new mom. Her name is Mrs. Etuknwa. Mrs. Etuknwa, it is such a pleasure to have you on Health Digest.
Thank you very much. I'm glad to be here.
It is exciting. So let's get straight to it. Last, you probably remember yourself when we talk about phases in life, and the pictures I saw, you were under the hot sun with your architectural gear, you know, on the site, and now you change diapers for a living. You're a nursery school teacher.
Driver,
you're a driver,
every other thing.
You're a cook, you're up at night, whether you want or not. When you used to be forced for night vigils, you used to complain, but now natural. You do it naturally. How do you feel with the word M-U-M? Some people say M-O-M, but it's called mom.
First of all, thank you so much for having me on the show. It's been an amazing one. And the transition from my career to being a mom has been nothing that no one has prepared me for. But the journey of it up until 9 months now, my baby is 9 months, just today actually. Thank you. So it has been quite challenging, but one thing that I do know is that most times it comes to you at ease because you're asking yourself, you don't know what you're doing. Am I doing it right? Am I doing it wrong? Is she going to be alive? Is she dead? What's happening? But at the end of the day, you just know that whatever God has given you, you're always doing it right.
Absolutely amazing. So you mentioned some interesting points. There's that first time try at everything. How did you find it mentally? Because I know I have a toddler myself, which you already know, a very interesting one. And I know that At night, I would literally check whether he's still
Still
breathing,
breathing.
if he coughs, if he's unable to poo or
Googling
something.
every symptom.
Everything wants to make me go wild. How did you go through that phase, and can you share some of the experiences that made you say, wow, God, I mean, Mom, I love you?
Honestly, I think we never really get the full grasp of motherhood and childhood until you become one yourself. So for me, it was more or less like a trial and error method. I just knew that the baby would be fine, but there were always those times where you'll be Googling everything, the color of the poop, the cough, the sounds that they make at night. And you know, the newborn phase, the 1 month to the 3 or 4 months, it's always very hectic because you don't exactly know what you're doing. I mean, yes, you've been surrounded by children, you've been surrounded by other babies, but once it's yours and you can't give it back to the mother, you have to make sure that you do it right. So I think that initial phase, it was challenging. I was always asking questions. I was always crying. Every time the baby would cry, I would cry too, because we were both new at this. But over time, we got to understand each other. I got to understand that with or without me, actually, she's going to be okay. But I'm just the primary health giver. I have to make sure that everything is in line. But look at her today. She's 9 months and she's all over the whole place.
Absolutely, absolutely amazing. As we mark Mental Maternal Health Day, the message is clear. Supporting mothers is both a job that includes care, mental and emotional well-being. Just as vital it is for mothers as it is for families, communities, and as a whole. Now, some people know me as a sweetheart, and some people would say that I definitely added to their mental health. And I'm talking about my mom. It happens to be her sweet 60. Yes, I want you and everyone to wish my mother, Ukeme Etuknwa, a happy birthday. I mean, we are looking at maternal mental health, and I wouldn't be able to bring this to you if she did not birth me. Thank you so much for staying tuned to Health Digest. I'm Ukeme Etuknwa. Remain blessed and not stressed. It's been such a pleasure. Bye-bye.